Good morning, everybody. When I was 10 years old, I attended a doctor's appointment that would forever change my perception of life. I'm sure you're probably thinking, well, that must be the time that you received your diagnosis of your terminal illness. However, that was not the case. Unlike some of the other speakers that were here yesterday, who had a later onset of a disability, I was born with spinal muscular atrophy, type 2, which is a neuromuscular genetic disorder. My family knew nothing about this disease. No one in my family had ever experienced it, and we actually did not have anybody in our family with a disability. But, like any good parents, they dove headfirst into learning and connecting with other families and specialists within the SMA community. Due to my diagnosis, I had routine doctors and specialists that I would see, pulmonologists, radiologists, cardiologists, neurologists, all of the ologists you could think of, I'd probably seen them. However, this specific day, when I was visiting a doctor that I was not super familiar with, I was just a 10-year-old waiting in the office and waiting for that expert's advice. This visit was one that forever left an impression on me. He started the doctor visit like any other, but he proceeded to tell me that the average life expectancy of a child with SMA type 2 was 15 years old. As he read that statement aloud, that was forever etched into my memory. Even as a 10-year-old, I had the thoughts, would I make it to 15 years old? Would I even have that many years? What could I possibly accomplish in 15 years? You see, up until this point, I was raised by parents who taught me to pursue life to its fullest, to chase my dreams, to go after hard things, and to do things that even normal kids don't do. My mom, in fact, would force me to do things like water ski or snow ski or wild and crazy things that other families probably looked at us like we were a little insane for doing. But she wanted to ensure that I was living a full life. I was a young girl, entering my soon-to-be teen years, but that number was always lingering over my head. How could I live this life on purpose, knowing what an average life expectancy was? But see, I realized at the time it wasn't necessarily the statistic that the doctor gave me that shook me, but rather the lack of empathy, encouragement, or even a strategic personal care plan for me that he did not help deliver. As I entered into my teen years and later adolescent years, I began to understand the importance of self-advocacy and finding doctors who saw me as the patient first. See, I always believe doctors know everything. I know how brilliant you all are in this room. I believe they have all the answers and that they have my best interests and that they would always point me in the right direction. I later learned the importance of both a well-educated professional and a patient-centered doctor when I was bringing my concerns to them. In recent years, the term ableism has been on the rise, but if I am completely honest with you, that was a term that I never fully aligned with or really even associated with. I felt like it was a term created by a people group who just wanted to complain about everything and who wanted to assign appropriate jargon to disappointments that they had within our society. But as I fully began to understand what ableism really was, I saw that that mindset of disregarding the term was actually ableism within myself. Who would have thought I could even be ableist? Even living with a disability my entire life, I had conformed to the social construct of wanting to live a normal life. And no, my parents raised me and taught me that my differences were positive and obstacles that I could obviously work through or overcome. I had disassociated myself with the disability community. I myself was stiff-arming the disability community. I wanted to prove so bad that I could figure life out. I didn't need the help of others. And I didn't want to be categorized by the marginalized community. I had learned pretty early on how to adapt to a non-adaptive world. And I believe that was a strength of mine. But it wasn't until I became a parent to a child with a completely different and complex disability than myself that I understood what true ableism is. The need for advocacy and the changes that really needed to happen within our medical field. I personally have encountered medical ableism on many, many accounts, and it was something that I had to speak up about and hopefully see change for the future, especially for my children. So just in case you were not here yesterday, or maybe you were sleeping yesterday during our sessions, I'm going to share just the basics of ableism. It's the discrimination or social prejudice and systematic inequalities against people with disabilities. It's based on the belief that typical abilities are superior, leading to devaluation and marginalization of people who have developmental, physical, or psychiatric disabilities. It can manifest in different ways: stereotypes, attitudes, institutional barriers, or physical inaccessibilities. So when I first was reading the definition, what really stuck out to me was the belief that typical abilities are superior. Because you could ask my family or friends who, spend everyday life with me, I do not have typical abilities. I'm not able to dress myself, I'm not able to prepare my own meals, or even feed myself half the time. But I was, learning, after learning truly what ableism was, I didn't even feel like that was the biggest threat to me. You see, I'm pretty independent, I'm pretty driven, ask my husband. I'm an outspoken person, I know how to overcome things in life, but I knew that I could teach people through my life and how I overcame things, that I was more than my abilities. Yet as I saw the problem really come to surface was when I realized that ableism was exposing itself in the medical field. I knew that's where the true work needed to happen, because the reality is, disabled people like myself, we need doctors. We need good, non-ableist doctors and researchers in order to live a qualitative life. The main problem is that people with disabilities are frequently encountering a healthcare system that diminishes their values, most of the time unintentionally. Now, let's think about it. A people group who may need more attention, more care, and more assurance just to live everyday life, it can get the most resistance and dismissive encounters. Now, Dr. Murray, I didn't know that you like acronyms so much, but I actually had fun with one well before yesterday. And is anybody in here named Alvin? Does anyone have a name Alvin? Okay, that's what Alvin is simply assessment of life value in numbers. You see, so many times I had numbers, the assessment of life value in numbers assigned to me. Data and numbers are absolutely vital in the medical field to make informed decisions for patients. Healthcare providers depend on these numbers. I don't have to explain that to you, right, the importance of it. But these numbers should simply be a tool in the patient care toolbox. So how do we work together to combine the incredible knowledge that professionals have gained in ongoing research and new medical discoveries with the qualitative value of patients' lives to create a patient-centered healthcare system? I am sure that if I ask any of you in here, why did you become a doctor, why do you want to be, or a researcher, sure, some of you might say, oh, I know since I was a kid, or I'm just naturally bent that way. But I honestly believe that at the core of your answer would be that you truly want to help people. But if we're only assigning numbers to people, are we actually looking at qualitative care and the patient's care first? I really hope that we can foster a discussion on how healthcare providers can evolve from detached professionals to empathetic advocates for the disabled community. So, just to share, I'm sure if I were to ask anyone here who is within the disability community, you could probably tell me stories where you felt as though you were dismissed, or maybe you saw very clearly ableism within a doctor visit. I remember one time I had entered into, or we had just moved here, we're from Arizona, we're not here, we're from Nashville, Tennessee. And I was trying to find a new primary care physician and filled out all my paperwork and obviously put my history down, and I went in to see the doctor. And I came in, and I'm an adult at this point. I had 2 children, and I actually had a skin rash, and I needed, just someone who could follow me and get to know me and build that relationship. The second the doctor came in, I realized he very quickly had an agenda to talk to me about my weight. And he didn't like the fact that I was 30 years old and weighed under 90 pounds. And as he began to talk to me about nutrition and gave me pamphlets and was bringing in a nutritionist, I was very confused because I'd never had this happen before. And I asked him, did you happen to read in my chart that I have a neuromuscular disease? And, yeah, I saw that, but really I just want to talk to you about healthy fats. And I remember being so confused as to why this doctor was bringing this to me at the time. And I left that doctor's appointment without any of my original concerns being addressed, simply because of the lack of knowledge. I also remember a time I was saying, I told you I've seen many specialists, and for someone with SMA, your pulmonary functions are the greatest concern most of the time. And I went to see a new pulmonologist. I was pregnant at the time, and we had decided, hey, we need to get everyone on the same plan and the same page for when we have surgery. And I went into this new pulmonologist appointment, and again, with all of my history in front of him. And he sat down and said, I want to talk to you about what it's going to look like to treat you. And I will tell you that is one of the biggest fears, because to be honest, yes, I have a lung capacity of 30%, but for someone with my condition, my age, I was doing pretty good. I'd been stable at those levels for about 10 years, and that was incredible. But he looked right past that. He was not even able to really bring any sort of help to the table. And I, again, had to go find some new doctors who were willing to hear me, hear my story, read my history. And that's just a simple, yes, it's okay to go find new doctors. I remember another time when I explained that, I was born with this condition. At 18 months old, was diagnosed with it. And there's never been a cure or a treatment for my disease. And a lot of time, we're within this community of people with the same disability as myself. And there was some exciting news, some exciting research happening. There was a new drug being passed by the FDA. And in 2019, it was officially passed. And I remember going to my doctors and explaining to them, because they really didn't know about it yet, at least this one doctor, and we started the process. And I remember the insurance denying me time after time again because I was over the age limit that they had done the research for, which I completely understand. The research was done for children 2 years and younger. But what did that mean for anyone over the age of 2? What it meant at the time was they dismissed us completely and said, honestly, it could work, we're not really sure, but it's really not worth trying. Again, a number was assigned, not only in the life of someone who was over the age of 2, but the insurance dollar sign was what really hung over everyone's head. They knew how expensive this drug was. Multi-million-dollar drug. And for us to be denied felt like our life just wasn't worth it. Yes, all of these situations contain a medical professional assigning innumerable values in my life without regards to my history, personal desires, or what life looks like for me with my specific disability. And though these can be kind of discouraging stories, I remember a time, and if you notice I did not share any doctors' names for those ones, but I had a doctor, her name was Dr. Carrie Francois. She was an incredible doctor to us, and the reason why was because my husband and I had just been married a few years, and we had decided we wanted to start planning a family. We really had no idea what that was going to look like. We went into this really open-handed. We're not naive to the fact that it could be potentially dangerous for my body. And so we did our due diligence, did some research. We found a high-risk doctor in the area. And we made an appointment, we sat down with her, and we shared what our desires were. We shared what our concerns were. And she looked at us and she said, I'm going to be honest, I've never had a patient with SMA deliver a baby. And so, obviously we had a feeling that was going to be her answer, but she said, let me go back, do some research, reach out to some other colleagues, and get back to you. And 2 weeks later, she called us into her office and she said, so there's really not a ton of research on this, but here is what I found. She presented us with all of the facts and the research and what some of her other colleagues had recommended, and she gave us a green light. We knew that there were obviously some risks within that, but it was something that we obviously changed the trajectory of our life. We now have a full family, but a doctor who was willing to say, I'm not really sure right now. I believe in you, but let's make a wise choice here, and still presented it all to us. It was an incredible gift to us. So you might be sitting here thinking, okay, Megan, so we heard some stories. What do we do? How do we actually move forward? What's my personal role in helping eliminate medical ableism? So I've kind of broken it down into some different categories. Those categories would be, and maybe you find yourself in multiple of these, I hope you do, but individuals within the disability community. Maybe you're a rising medical professional or med student, or maybe you're a current or a long-standing medical professional, provider, or researcher. So a lot of that was storytelling. If you are taking notes, go ahead and write these down. If you're not taking notes, go ahead and write these down as well. But these are really simple. These are things that I believe are the simple steps forward. So within the disability community, here's 2 ways that you can help combat and eradicate medical ableism. Number 1 would be speak up and be a self-advocate. I know that actually can be an exhausting task. It really can be. It can be tiring being the one who goes into doctors' offices and is explaining, your entire disability to them, but honestly, that's what it's going to take to save movement. I would encourage you that anytime you go in, whether it's a new doctor or one that you've seen for a long time, be willing to share your experience, share where you're at. It's okay to ask for other opinions or other, recommendations. Like I mentioned, the pulmonary function is a really big concern for patients with SMA like myself. And I've known for a long time that I needed to be on some assisted breathing in the evening time when I'm sleeping. But it's been a big fear of mine, to be honest. And I had done, all of the sleep studies, and they were showing the estimating you really should be on the BiPAP machine or CPAP machine at night. And I went in and I did all of my procedures, and they came back to me and said, okay, according to your levels into insurance, you're going to be on a CPAP machine. And I remember just feeling like, that doesn't seem right. It doesn't seem like the right answer. And so I went back and I talked to some other people within my community, and they said, CPAP is actually extremely dangerous for somebody with neuromuscular disease. You really need to be on a BiPAP machine. And so I had done, my research and reached out to other pulmonologists who had experience with neuromuscular disease, and they concurred and agreed that I really need to be on a BiPAP machine. But I wouldn't have known that if I hadn't reached out to the community. And so that would be my number 2, is community engagement and feedback. Be willing to join in your disabled community and learn from them. And feedback, things like this, things like research groups. We talked about, nothing, we don't want things done on our behalf without us being there, but we actually have to show up and be there. So be willing to join research groups and be willing to be part of it. I know it's a little extra on our plate, but I promise you it's worth it. So let's see, the next group would be the up and rising med students. I would say the number 1 is inclusive education and training. Advocate for curriculum that includes modules on disability studies and ableism. This can help future medical professionals understand the challenges faced by disabled individuals and the importance of providing adequate health care. Make sure you are in those conversations continually. Number 2 for you would be find yourself a mentor. Find yourself a mentor, not just, who you're necessarily training in, but someone who will call out the ableism within your thought process. Lastly, I would say your current providers and researchers, Number one is be willing to listen. Be willing to listen. I would say even within that, a lot of my struggles came from providers not having comprehensive chart reviews, if I'm just completely honest. The amount of stories where doctors are just kind of zooming in, zooming out, not taking the time to hear why I'm there or what my needs really are, actually had a lot of dangers in it, and a lot of consequences. So I understand you don't always have all the answers, and that really just leads me to number two, which is lifelong learning and flexibility. Continually change, continually challenge the ways of your practice. Old practice is old practice for a reason, because we're continually learning and doing better. That Dr. Anthony Kasama, who was my neurologist, who really fought for me to get on that drug, that treatment that they just passed in 2019, he became one of my biggest advocates as a doctor and has forever changed my life. And to be honest, when I first came to him, he did not know about that treatment. It was so new on the market. He was familiar with patients with SMA. And I remember bringing it to him, and again, he later went back, did his research, and now he comes to me to say, hey, Megan, insurance is going to fight you on this. Here's the form. I already filled it out. Let's move forward with this. I can tell you, having a doctor who I feel like is my advocate is one of the greatest gifts to my family. So, have you guys ever seen the movie Along Came Polly? Yeah, so you're shaking your head. It's an old movie. Just in case you haven't, or if I need to help jog your memory, it's a movie about Ben Stiller and Jennifer Aniston. And he is an amazing risk calculator. But because of the risks calculations that he does in his everyday life, he struggles to find the joys of his life, leading to an important realization that when we overcalculate our risks, we don't leave any room for life to grow. So I've shared some stories about doctors who maybe had a lack of knowledge or just blatant medical ableism, and it got in the way of caring for me. But what I wanted to really underline here today was to remember why you're doing what you're doing. It's because there's a human behind every research project, behind every doctor's appointment. There's a human that's coming to you for care or for information. And remember that that human is more than a disability. They're living a life outside of those four walls of the human is. That's where you can get back to understanding what your care, why you're providing that care. I shared with you different situations and experiences of doctors that I had, and doctors who intentionally work through medical ableism, and they have amazing practices to this day. Good doctors, bad doctors, but it was beyond walking through those hard situations. I think back, and it's really about that 10-year-old girl who thought her life would only live to 15 years. And I learned that I'm more than numbers or statistics, because you see, next month, February 2024, I will be approaching my 35th birthday. And it's not about surpassing the 15 years. Yes, that's incredible. But it's about what I've been able to do and the life I've been able to live in those 20 years in between. The fact that in those years I've become a wife, a mother of two, an entrepreneur, a business owner, an author, and I have many more plans for my future. But I honestly could not have done it without the doctors who were willing to stop and be on my team. So before I go into any kind of Q&A, I know some of you might be thinking, I heard and saw that you have a book out there, but it looks like a little kid book, so what is all about that? So the area that I am just extremely honored and privileged to get to do, honestly, my work of combating ableism is with children. And you see, I explained that I had a son with a disability. My son was diagnosed with cerebral palsy at birth. And he is our 10-year-old son, and we have another son, his name is Sean. 8 years old. And Shy and Bronx were about 3 and 4, 4 and a half at the time. And my younger son, Shy, looked at me and he said, Mom, why are you and my brother not normal? If that's not an ableist comment, I don't know what is. And so I knew at the moment that was a teaching pivotal time in my 3-year-old's life. And I'm a pretty feisty, outspoken person, and so I wanted to give him kind of a smarty pants answer, but I knew that this 3-year-old was genuinely curious. He was curious, why are you in a wheelchair and my 4-year-old brother doesn't walk, but Daddy and I are normal? And I remember that's really when the idea and the birth of my children's books and resources were birthed. And I knew that if my children had questions, children who have lived every single day strapped to their mom's wheelchair or cruising around town, if they had questions about people who were different than them, I knew other children had questions too. So I created some resources of coloring books and children's books. And I have the privilege of going to other schools and other universities even, and I teach kids about disabilities and about differences. Because I really believe that if we can expose kids at a young age to differences, as they grow older, they won't have such a hard time accepting them. And on the flip side, I wanted children with disabilities to see themselves represented in our literature, in fun books, not just in science books, right? In fun and interactive children's books. So that's what I created. So whether you have kids or you know a kid or you just want to pass it out to someone, I would encourage you to pick some of those up. They're really fun and really great resources. But yeah, that's part of my story, and I just wanted to thank you, and I wanted to commend you all for being here, because the fact that you showed up to a symposium like this that is discussing a hard topic, it shows that you really do care about change in the future. So